Breast Cancer by Shauna Fairbanks. Breast cancer is the most common cancer in a woman, while lung cancer is the leading cause of death. Breast cancer affects women worldwide, with approximately 1.5 new cases occurring each year. 1 in 88 women who live to be the age of 80 will develop breast cancer at some point in their lifetime. In the United States, more than 200,000 women are diagnosed with invasive breast cancer each year. The body is made up of trillions of cells categorized at 200 different types that combine to form human tissues, such as skin, muscles, bones, breast, and blood. Normal body cells grow, divide, and die in this order. In the early years of a person's life, cells divide faster to allow a person to grow. After this person is an adult, cells only divide and replace worn-out, dying cells or repair injuries. Cells of different tissues and organs divide at different rates. Skin cells divide at a more rapid rate than a nerve cell would. Nerve cells divide at a slow pace or not at all once the nerve cell matures. Cells are designed to prevent them from making multiple copies of themselves or to form making flawed copies of themselves. For cells to stay alive and healthy, they must decode, filter, and respond correctly to molecular conversations. Normal cells are stimulated by to multiply by molecular messages called growth signals. When they need to stop growing, they receive an anti-growth signal. Cancer starts with cells in the part of a body that begin to grow out of control. Although there are many types of cancer, they will form out-of-control growths of abnormal cells. Instead of dying like a normal cell, cancer cells continue to grow and form abnormal cells. They also grow into other tissues that standard cells cannot do. The charismatic of a cancer cell is that it grows out of control and invades other tissues. The first stage of cancer is that cancer cells form because of the damage to its DNA. DNA is in every cell and directs all of its actions. Normal cells repair the damage of the DNA, or the normal cells die. And cancer doesn't die. It continues to reproduce with the same damaged DNA. The second stage of cancer is called progression. The cancer cells can invade recognition by the immune system and develop their blood supply and spread in different areas. Several years may pass before a single abnormal cell divides and cancer is detected. By the time a tumor is large enough to feel a lump or to be seen in an imaging test, the tumor may already have 1 billion cells. Cancer cells travel to other parts of the body where they can grow and form new tumors that replace normal tissues. This is the process called metastasis. No matter how the cancer is spread, it is always named from where the cancer originated, because the cancer grows at different rates and responds to different treatments. Structure of the breast. The breasts are composed mainly of connective tissue and fatty tissues. Inside the tissues is a network of milk-forming lobes. Each lobe has many smaller lobules. At the end of each lobule are milk-producing bulbs. The thin tubes are called ducts that are connected to the bulbs. Lobules and lobes to the nipple. The dark area of the skin surrounding the nipple is called the areola. There are no muscles in the breast. The muscles are under the breast tissue covering the rib cage. Blood vessels and lymph vessels run throughout your breast Blood nourishes the blood cells. Lymph vessels carry a clear fluid called lymph, which is immune system cells, and drain waste products from the tissues. Lymph vessels lead to pea-sized collections called lymph nodes. Most of the lymph vessels lead to lymph nodes under the arm called axillary nodes. Cancer is a malignant tumor that starts from the cells in the breast. The process before the tumor begins starts with normal cells. The carcinogenesis is a multi-step process over the growth of abnormal cells. Normal cells start in an orderly fashion of growing and dividing. As you can see here is the stages of cancer. Hyperplasia is an overgrowth of cells that are stacked on top of one another, with some cells starting to look abnormal. Non-invasive cells are abnormal cells that are confined to the normal borders that continue to change and multiply, evolving into cancer. Invasive cancer are abnormal cells that invade deeper into the surrounding areas of the body. They enter into the lymph channels and the capillaries that carry the blood cells into other parts of the body. When you're doing a self-exam, this is what you want to look for. You want to look for a lump, pulled in nipple, dimpling, dripping, redness or rash, or any form of skin changes on the breast tissues or in the armpits. Common sign of cancer is a lump on the breast. The lump may have pain or none at all. Tumors are often found in the upper part of the breast or in the armpit area. When it is found, it may feel soft, rounded, or firm and hard. Cancer cells are often found in the other arm of an auxiliary lymph nodes. With cancer cells able to spread through the nodes, they are examined to see what the stage of the cancer is. There may be no signs or symptoms. However, the lump is the most common sign. Other signs may include or stand alone. The size of swelling of part of your breast. You may have discharge that appears bloody or clear in color. Inverted nipple that won't go back outward. The nipple may become thick, irritated, with itching or burning. One of your breasts may look like an orange peel. Puckering of the skin or the breast tissue may develop in a dimple. If you have any concerns, just go see. Two images will be taken. One will be a close-up of the site of the abnormal tissue, and one will be a magnification of the small mass or microcalcifications. If you have had any previous mammograms, the images will be compared to each other during the mammogram. X-ray imaging. Your breasts are compressed between two firm surfaces to spread the breast tissue. An MRI is a little bit more invasive than a mammogram because of the contrast agent that is given through an IV before the procedure. When getting an MRI, it should be taken at a facility that performs a biopsy on site. The biopsy will determine the stage of the cancer cells that were removed from the breast tissue. The pathologist will study the tissue and will outline the number of details about the cancer and determine the best form of treatment. The The use of breast exams in a clinical setting, ultrasounds, mammograms, MRI, biopsies, and self-awareness of changes in the breast are the best chances that will reduce your chance of dying from the disease. Your doctor may recommend chemotherapy alone or with a combination with radiation therapy, hormonal therapy, targeted therapy, or surgery. The results will determine the types of cancer and what stage the cancer is at. Where the cancer is determines the type of treatment you'll receive. Chemotherapy kills the cells that are in process of splitting in two. Because cancer cells divide much more faster than normal cells, they are more likely to be destroyed by chemotherapy drugs. You may receive chemoradiation therapy by IV, injected into the bloodstream, or you may receive therapy by oral tablets or capsules. The drug circulates through the bloodstream and can reach the cancer anywhere in the body. Radiation therapy uses high energy particles or waves. External radiation uses high energy rays, beams that are aimed precisely at the tumor. This therapy is an outpatient therapy that may last several weeks. Internal radiation is an implant that holds the radiation in the small sealed holder. The implant is placed near or inside the tumor so that it only harms a few normal cells. Systematic radiation can be given by mouth or through an IV. The radiation will travel throughout the body. They collect where the cancer is and give off their own radiation and destroy cancer cells. Hormone therapy for breast cancer is treatment for the breast cancers that are sensitive to hormones. The most common forms of hormone therapy for breast cancer work by blocking hormones from attaching to the cancer cells, or by decreasing your body's production of hormones. Targeted therapy for breast cancer uses drugs that block the growth of cancer cells in specific ways. Targeted therapy may block the action of the abnormal protein such as HER2 that stimulates the growth of breast cancer cells. The side effects are far less severe compared to chemotherapy. Locking the door in about remission. There are several tests after treatment or surgery, and they will tell you if you're in complete remission or complete response. Complete remission is that cancer is not detected in any of the tests or scanned images, or they will tell you that you are in partial remission or in stable disease. This means that the cancer treatments killed some of the cells, or the cells has shrunk and is not growing. The treatment may have helped so that the other treatments are more likely to work. Some of the after effects may include early menopause, menopausal symptoms, fertility issues, emotional distress and depression, fatigue, insomnia, fear of recurrence, sexually and intimacy issues, and some conditions are related to specific treatments. Some of the short-term effects are hair loss, weight loss, nausea and vomiting, fingernail and toenail weakness, pain, mouth and throat sores, fatigue, constipation, diarrhea, temporary loss of menstrual periods, menopausal symptoms, infection, weight gain, and sleep disorder. Prevention. Avoid becoming overweight, eat healthy, keep physically active, drink little or no alcohol at all, don't smoke, and if you bear children, breastfeed your babies for as long as possible, avoid any hormone treatment, get regular breast cancer screenings, extra screenings, estrogen blocking drugs.